This is Mike. One day, Mike received a phone call stating that the images are back and that he has cancer. Confused and scared, Mike went to see his provider at Cedars-Sinai Medical Center, Samuel Ocean Comprehensive Cancer Institute. Mike had a lot of questions for his provider. What type of cancer do I have? Is it curable? What should I expect? What is my prognosis? And what is radiation oncology?
Radiation therapy works by damaging the DNA within cancer cells, destroying their ability to reproduce and causing the cells to die. Basically, when the damaged cancer cells are destroyed by radiation, the body naturally eliminates them. Normal cells can be affected by radiation, but they can repair themselves in a way cancer cells cannot. While radiation therapy is often used to cure cancer, sometimes the goal is to only reduce symptoms caused by growing tumors and to improve the patient's quality of life. When we use radiation to cure cancer, basically go in to destroy tumors that have not spread to other body parts, shrink the cancer before surgery, or even reduce the risk that cancer will return after surgery or chemotherapy. When used for palliation, to reduce symptoms basically, we shrink tumors affecting the quality of life, like a lung tumor that is causing shortness of breath, or we alleviate pain or neurologic symptoms by reducing the size of a tumor. Example, a tumor on the spine. So these are the side effects. They're basically based on the location of treatment, in addition to if patients had surgery prior and or concurrent chemotherapy. First one we're going to look at is brain, head and neck, breast, chest, stomach and abdomen, pelvis, rectum, we have 10 amazing radiation oncologists. Each radiation oncologist has a certain specialty that they treat. We have 8 here at Cedars-Sinai, and then we have 2 radiation oncologists who treat at our sister facilities in Beverly Hills and our new facility that's ready to be open in 2019 in Tarzana. Our team also consists of lovely radiation therapists, radiation technicians, dosimetrists, physicists, medical secretaries, residents, and let me get a drum roll, our awesome nurses. We have 4 registered nurses, 1 clinical partner, and 1 nurse practitioner. And the other radiation cancer team members also include our social workers, who are amazing, nutritionists, speech therapists, dentists, physical therapists, supportive care management, pain management team, and psychiatry. Our nursing roles are, we have a rooming process. Education is huge in radiation oncology. Educating patients for them to know what symptoms they should expect during treatment. Dressing changes, IVCTs, assist with procedures such as the space oars, brachytherapy, cylinders, even scopes for our head and neck patients. Coordinating chemotherapy with radiation start dates as well. We have 3 machines. The external beam, which are the machines that typically delivers radiation using a linear accelerator. And those 3 machines are TrueBeam, Trilogy, and Versa. Our internal radiation therapy, which is called brachytherapy, involves placing radioactive sources into or near the tumor. So that is our HDR/superficials. There are different types of radiation treatment. We have SRS, which is normally the treatment that we use to treat the brain. SBRT normally range in between 3 to 5 fractions of treatment. We have IMRT, which can be a range of any amount of fractions, and that is dependent on the dosimetrist and the doctor. Quad shot, normally used with our head and neck patients. And then we have standard fractionation, which is about 5 to 6 weeks of treatment occurring 5 days a week. Radiation measurement is done by using centigrade or gray. It's some places that use rad, but here at Cedars we use centigrade or gray. So Mike, the steps that you would have to go through once you're referred by either your medical oncologist, your surgical oncologist, or just a self-referral, you would first have a consultation. After your consultation, you will do a CT simulation. Sometimes that is included with oral or IV contrast, or either both. Then our wonderful doctors, our dosimetrists, and our physicists, they will start your treatment planning. The treatment planning normally takes about 5 to 7 business days. So Mike, your treatment process will be your first day of treatment. Then you'll go to having your however many treatments that you're going to have. You will have a weekly OTV visit. That weekly OTV visit will be 1 day a week. That way, if you have any questions, the doctor can assess your skin, all that good stuff. And then your last day, and you'll receive discharge from our beautiful nurses. And then your follow-up appointment will be based off your provider and also your radiation site. So, if you're ready, let's go ahead and schedule this consultation. So Mike, this is the best part, your final day of treatment. So here's your certificate, and are you ready to ring this bell? Let's go.
The good luck bell, ring this bell 3 times well. It's told to clearly say, my treatment's done, the course is run, and I am on my way.